Let me start by respecting our Master of Ceremony. I also want to recognize our Deputy Minister, Honorable Kwidini. He has just left for another meeting, but he was here with us a few minutes ago. Our Permanent Secretary, Dr. Maongan, is represented here by a new person in the ministry, Dr. Nyambayaro. I'm sure our Master of Ceremony just missed it. Dr. Nyambayaro, I recognize you. Our Health Service Commission Secretary, Dr. Pasi. Let me also recognize Dr. Mawomva, the Health Advisor to President and Cabinet. I'm really happy to see her here because she has been running around with this issue of the Public Health Institute for quite some time. And I'm sure she's smiling that it is coming to fruition. Thank you very much, Dr. Mawomva, for your work that you have done all this time. All senior government officials here present, our WHO representative, well, we saw Dr. Tirune presenting there. Our EU Health Advisor, Rosin Rooney, and other partners here present. I did not see a representative from Africa CDC, and they also failed to present here, but I want to acknowledge them. Our partners, distinguished guests, ladies and gentlemen, it gives me great pleasure to join you at this historic and inaugural inception meeting marking the official launch of the Zimbabwe National Public Health Institute, the Zimbabwe NPHI. I must apologize that yesterday I failed to make it to the first meeting, but we are here together today. Today we stand at the dawn of a new era in Zimbabwe's public health architecture. This is not just another meeting, it is a moment of collective vision, courage, and responsibility. A moment when Zimbabwe boldly takes its rightful place among African nations, investing in strong, coordinated, and resilient public health systems. Allow me to begin by congratulating ourselves as the Ministry of Health and Child Care, and indeed our government, for taking this decisive step. Establishing the Zimbabwe National Public Health Institute demonstrates foresight, leadership, and commitment to the health and security of our people. It signifies that we as a nation are not waiting for the next health emergency to act. We are acting now to prevent, prepare, and protect. I wish to express my deep appreciation to the World Health Organization and the Africa Centers for Disease Control and Prevention, that is Africa CDC, for their unwavering technical leadership and partnership in this journey. The World Health Organization continues to play a global normative role, setting standards, providing guidance, and ensuring that principles of health security and system strengthening are globally consistent, yet locally relevant. We value this global stewardship and look forward to WHO's continued leadership alongside the Africa CDC, which brings an African context and voice to our health security architecture. Together, WHO and Africa CDC have worked with us and hand in hand to ensure that Zimbabwe NPHI is not only born, but born right. We are proud to be part of the Africa CDC's new public health order, which calls for stronger institutions, a well-trained workforce, domestic financing, and local manufacturing of health products. Zimbabwe is ready to play its part, and today we proudly join other member states who have taken the path to secure the health of their nations and our continent. I wish to recognize the strong support and collaboration of other line ministries and government departments that have rallied behind this initiative. The establishment of an NPHI is not the responsibility of one ministry alone. It is a whole of government endeavor anchored in collective accountability for health outcomes and national development. From finance and higher education to environment, agriculture, and local government, every ministry represented here today is a partner in this journey. Your continued collaboration is both valued and indispensable. As we set up this institution, I am pleased to announce that I will personally chair the NPHI Steering Committee, supported by the Permanent Secretary and NPHI Coordinator. Together, we will ensure that the NPHI's establishment remains on course, accountable, well coordinated, and aligned with the ministry's broader reform agenda. I pledge to remain a dedicated advocate for this institute, working closely with WHO, Africa CDC, line ministries, and our development partners to ensure that Zimbabwe's NPHI is not only established, but positioned as a center of excellence in public health governance, research, and response. Dr. Maomva, I urge you to continue your guidance so that you see what you started brought to fruition. Over the next 3 days, we must remain focused and determined to achieve the 9 carefully crafted objectives of this inception meeting. These objectives, which include defining the structure, endorsing the steering committee's terms of reference, aligning funded programs, setting up a robust resource mobilization framework, and developing a clear monitoring and evaluation system, will form the foundation of this new institution. Diverse views will certainly emerge as we deliberate, and this is expected, and indeed it is healthy. However, the government's position is firm. The NPHI will be established under the Ministry of Health and Child Care, and in due course, it will evolve into a semi-autonomous institution, one that enjoys the necessary independence of research and technical function, while remaining accountable to the public health mission of the state. The NPHI is to be established in its totality, not as a project, but as an institution that integrates all core public health functions. As we launch, I wish to emphasize the importance of using non-communicable diseases, amongst other epidemics, as a pilot intervention for this new institution. Zimbabwe is not setting up its NPHI in the context of an emergency outbreak or humanitarian crisis, but in response to a silent epidemic, the growing burden of NCDs which have been under-prioritized for more than 2 decades. This will allow the NPHI to demonstrate its full value, applying research, surveillance, and innovation to one of the most pressing health challenges of our time. We are deeply grateful to the European Union for its catalytic funding, which has enabled the planning and hosting of this inception meeting. This support signals confidence in Zimbabwe's health governance and serves as a cornerstone for future collaboration. I take this opportunity to call upon our development partners and friends of Zimbabwe to join this journey through technical assistance, financial investment, and strategic collaboration. Together, we can build a sustainable and resistant NPHI that serves both national and regional interests. I also wish to invite our provincial medical directors, city health departments, and national agencies represented here today to lend your full support. Your engagement will be the lifeblood of this institution as we translate national strategy into practical results across all provinces and cities. Colleagues and friends, today we are not just launching an institution, we are shaping the future of public health in Zimbabwe. Let us commit to working together with focus, unity, and determination to deliver on all 9 objectives of this meeting and to ensure that the Zimbabwe NPHI stands as a symbol of national resilience, technical excellence, and visionary leadership. With this resolve, I now officially declare the inaugural inception meeting for the establishment of the Zimbabwe National Public Health Institute officially open. I thank you. Ndinotenda. Ngiyabonga.